Bismillahirrahmanirrahim. It's me, Mr. Reza, a student of Osh International Medical University. We are students of Group C, the Insomniac Medicos.
My name is Aftab Baluch. I am Mohammed Salman.
My name is Tanur.
I am Humar Hussain.
My name is Amnabini.
I am Abdul Sarwar.
And today our topic of discussion is the effects of tobacco and alcohol. Bismillahirrahmanirrahim. So today our topic of discussion is about effects of tobacco and alcohol. So first of all, let's begin with the tobacco. Actually, tobacco is the common name for several plants, and also the tobacco, it has more than 70 species, and the most important type of tobacco is Nicotiana tabacum, and the most common cause of exogenous cancer is also tobacco. That means 90% of the lung cancers are caused due to tobacco. And if we talk about the oral cancers are also caused due to tobacco. And basically in oral cancers we are having two things. The first one is cigarette smoking and the second one is smokeless tobacco. Smokeless tobacco, for example, we have the snuff, that we say naswar in our language, and second one is chewing tobacco. It is also a type of tobacco. And the next one is the lung cancer. So what is the lung cancer? Lung cancer is also mostly caused due to having tobacco. And basically there are two types of lung cancer. Caused due to two reasons, right? The first one is active smoker. Active smoker are the people, for example, we are standing in some place and there are some people around us and they are smoking cigarette, right? They are called as passive smoker, and the active smokers are those who are smoking cigarette. That's very simple, right? And also the second-hand smoker. Passive smokers are also called as second-hand smoker. And the next one, if we talk about the statistics of the tobacco, the very 2/3 of the smoking occurs in 10 countries in the world. The very first country is the China. In China, basically 30% of the smoking occurs. And also China is considered the largest producer and consumer of the tobacco. And the second one is India. 10% of the smoking or tobacco is produced in the India. And the next one, the third one, it is the Indonesia, and the fourth one is the Russia, and the fifth one is United States of America. So in United States of America, 4 lakh people die per year due to smoking tobacco.
Bismillahirrahmanirrahim. What is tobacco smoking and carcinogens? Smoking is defined as burning of tobacco and ingesting of smoke. All type of tobacco smoking is injurious to health. Cigarettes, cigar and pipe tobacco are made up of dried tobacco leaves. Other flavors and chemicals are added to make smoke pleasant. Smoke from these products is a complex mixture of chemicals, and tobacco smoke is made up of thousands of chemicals, from which almost 70 are known as cancer cause or carcinogens. Some types of carcinogens are nicotine. Nicotine is the main addictive drug which makes the person addicted to these tobacco, and it has effect on the brain, for which people are looking for. Other carcinogens are hydrogen cyanide, formaldehyde, lead, ammonia. Some of these chemicals can cause heart disease and other serious problems of health. Smokeless tobacco products. There are main 2 smokeless tobacco products, snuff and chewing tobacco. They contain high level of tobacco-specific nitrosamines and polonium-210. Cancer-causing mechanism of these products. Chemical from the smoke are get into the main bloodstream, from which they can flow to all parts of body. They can cause the damage to the DNA of cell, which regulates the cell growth and other main functions of the cell. Damaged DNA leads to unusual cell growth, and these unusual cells then turns into cancer cells.
Smoking is the practice of burning tobacco and ingesting the smoke that is produced. The smoke may be inhaled as it is done by cigarettes and cigars. Next we have the smoking agents, which causes the mucosal irritation of tracheobronchial tree that ends up with the inflammation and with increased mucosal production. Due to inflammation, the which is called bronchitis or acute bronchitis. Next, smoking agents can lead to recruitment of leukocytes in the lung tissues that increases the elastase activity, and due to this activity there is a damage to lung tissues and causes a disease which is called emphysema. It also causes chronic bronchitis and COPD. COPD stands for chronic obstructive pulmonary diseases. Next, smoking also causes many other diseases, like smoking causes the lung cancers, peptic ulcers, esophageal cancers, cancer of pancreas, cancer of kidneys, cancer of cervix, cancer of bone marrow, and cancer of blood cells, which is called leukemia.
Include my topic in smoke and inhaling the smoke of any substance. For the use of smoke and apparatus included but not limited to cigarette and pipe. Smoking associated with other disorder, it causes cancer, esophageal cancer, duodenum and stomach cancer, and pancreatic cancer, and renal and kidney cancer, and cervical cancer, urinary cancer, bone marrow cancer, and blood cell cancer. The second is smoking associated myocardial infarction. First one is atherosclerosis. It increases platelet aggregation and increases myocardial bone oxygen, and it decreases oxygen supply, and it decreases the threshold for ventricular fibrillation. Second is a pregnant female. Into first trimester it is well end of subcutaneous absorption and miscarriage before 20 weeks of gestation, and recurrent birth, delivery of the baby before 37 weeks of gestation. That's all.
Bismillah Rahman Rahim. Today's my topic is about smoking that causes atherosclerosis. So before really discussing about that, I want to throw some light on atherosclerosis. What is atherosclerosis? Atherosclerosis is the buildup of fats, cholesterol, and other substances in and on the artery walls. In means inside the artery walls and outside the artery walls, but they will affect the flow of the blood inside the artery. So that is called as atherosclerosis. The buildup is called as plaque. That is the buildup that is made up of that is called cholesterol and all other substances, that is called as plaque. So that plaque will cause the arteries to narrow, blocking the blood flow. It will narrow or will block the blood that cannot pass it through the artery. This is called as plaque. So after that, there are some stages of the atherosclerosis. There are 4 stages of atherosclerosis. These are endothelial cell injury. Any endothelial cell injury will cause atherosclerosis. Lipoprotein deposition. Third one is inflammatory reactions. Fourth one is smooth muscle cell cap formation. So this is little bit about atherosclerosis. After that, how the smoking can cause atherosclerosis. So this is as we smoke the atherosclerosis, how the atherosclerosis will produce. The atherosclerosis will produce because after smoking there is increase of the platelet aggregation. So increase of platelet aggregation in our arteries will it will be in myocardia in the heart. So myocardia is the heart wall, is the heart layer. So in that it will cause the platelet aggregation. So the increase due to that platelet aggregation, there is increase of O2 demand, oxygen demand, and the decreased supply. Because as you know, there is an artery, there, for example, is a myocardia. So in that, if there is a platelet aggregation there, and the platelet aggregation will never lead to the blood to go before that. So therefore, the blood the O2 supply will increase, the O2 supply will decrease, but the O2 demand will increase, which will lead to atherosclerosis. And there is also the decrease the threshold for the ventricular fibrillation and causes the hypertension and hypercholesterolemia. So what is how it will decrease the threshold for the ventricular fibrillation? As that is by the the ventricles are unable to push.
Assalamu alaikum. Now I am going to tell about features of smoking. Smoking in pregnant female lead to spontaneous abortion less than 20 weeks. Second one is smoking lead to preterm birth less than 37 weeks. Third one is stillbirth means dead baby, intrauterine growth retardation. Increase quiescent metabolism of nicotine in blood of active smoker. Number 3, in children, respiratory illness, asthma. And 4 one is smoking plus alcohol multiplies risk of cancer, oral cancer, esophageal cancer, laryngeal cancer. And number 5th, exposure of extraneous uranium lead, esophageal and laryngeal cancer. Thanks.
Assalamu alaikum. My name is Ali Taimur. Today I will tell you about alcohol. So this video is dedicated to Dr. Muhammad Qasim, who is teaching us in OSH-IU. So what is alcohol? Alcohol is a hazard for health. It's more dangerous for us. So it is more dangerous than heroin and cocaine. And moderate amount of alcohol will lead to survival than heavy drinkers and teetotalers, which means people who never drink. So 250 ml of a wine per day leads to decrease the platelet aggregation. The second one is decrease the fibrinogen. The third is decrease the coronary heart disease. And the fourth is which increase high density lipoprotein, which also called in short form HDL. Now we come to the statistics. In Western countries, 50% people are alcoholic. Number 1 is 5 and 10% people are chronic alcoholic. And the second is 1.8 million people die per year just because of taking alcohol. The 50% death occurs due to drunk drivers, homicides, suicide, and the last one is liver cirrhosis. Thank you very much.
Bismillah ar-Rahman ar-Rahim. Now we will discuss about the mechanism of alcohol. So first of all, when the alcohol intakes, there are absorption of unaltered ethanol. The absorption of unaltered ethanol will be in stomach and small intestine. So the absorption of unaltered ethanol in the stomach, from the stomach and small intestine, it will be equally distributed in body fluid and itself blood. So from blood, the ethanol, there will be about 10% of alcohol excreted from the body through 3 ways, like sweat, urine and breath. So as we know that there are some enzymes present in our body, like in liver especially. When the ethanol from the blood passes through the liver, as we know that blood passes through the liver with the activation of some enzymes. So there are 3 enzymes in our liver. First of all, that is alcohol dehydrogenase. Alcohol dehydrogenase, basically it is an enzyme, it present in the cytosol of the hepatocytes, and there is a system that called cytochrome P450 system, which helps in the production of metabolic acidosis. Basically acidosis, it is the increased level of acid and as decrease in pH level, and also increased level of fat in liver. Fat drops in liver also will be increased with the help of cytochrome pH system, P450 system helps. And the second one is microsomal ethanol oxidizing system. Microsomal ethanol oxidizing system, basically it deactivated when there is the increased amount of alcohol present in our blood. And also there is a third one is catalase, which is work with the help of hydrogen peroxide. It activated when there is 5 or less than 5% of alcohol present in our body, and these are when these 3 enzymes are activated, the acetaldehyde will be converted into acetate, which is present in mitochondria. Acetate in mitochondria, which is utilized for the respiratory chain, which is also called electron transport chain. And now, if we talk about the drug drivers, as we discussed, drug drivers, there are about must be 80 gram per deciliter of alcohol present in blood of the drunk drivers. There are three ways, one is standard, 3 standard drinks, 3 bottle beers and 15 ounces of wine. And now next one is, if there are 200 gram per deciliter of alcohol present in the blood, then it will be ends to the drowsiness. And if there is 300 gram per deciliter of alcohol present in the blood, it will be called stupor. Stupor basically it is a state which is near to the unconsciousness. And the third one is greater than 300, greater than or more than 300 gram per deciliter of alcohol present in blood, which will affect the respiratory arrest. And there is the chronic alcohol. There is the chronic alcoholic beers, which will bear around about the 700 gram per deciliter of alcohol, and it is not the appreciated effect, but it is the effect which affects our body. Thank you.
Assalamu alaikum. Today I am going to explain acute alcoholic. Acute alcoholic, it is irreversible, and there are 3 organs which damaged by acute alcoholic. Alcoholic damage 3 organs. First is CNS, central nervous system, then stomach, then liver. CNS. How alcohol damage CNS? It means when alcoholic increase in CNS, these things occurs. Means first depression, subcortical damage, interception plus basal ganglia. Then impaired cortical area, nephrons, impaired motor system, and inhibition activity. Then when alcoholic increase in blood, it occurs leads to damage to cortical nephron, lower medullary central, and cause respiratory distress. Means death occurs when a respiratory arrest occurs. Then stomach. How alcohol damages stomach? Use of alcohol damage in 2 ways to stomach: acute gastritis, acute ulceritis. Acute ulceritis means heat burn occurs in the stomach. Then liver. When acute alcohol increases in blood, then it leads to also hepatic steatosis, means fatty deposit on liver, fats deposited in the liver. Thanks.